Hello, and welcome to VOW, Voices of Wisdom, the show that might not be for everybody, but everybody needs to watch this show. And I am your host, Brenda Simmons. VOW is basically on relationships, and I usually bring topics that are educational, informative, and sometimes controversial. Today, my program is about home medicine care. And today I have for my guest, Dr. Donald Claxton. How are you today?
Fine, thank you.
Very well, very well. So we got to finally do this program. And just tell me a little bit about yourself and about your background.
Well, first of all, thank you for inviting me to this program.
You're welcome.
I look forward to the conversation that we're going to have.
Yes.
I am a physician, a medical doctor. I have a company that provides nurse practitioners to see patients in their homes, elderly patients, people who are homebound. We try to assist them in staying well or getting better if they happen to be just recovering from an illness.
Tell us a little about your educational background. How did you start? Where did you start in your medical field?
Well, I went to New York University, did my pre-med study at New York University, then went to Baltimore and did medical school at the Johns Hopkins University School of Medicine. After that, I spent about 3 years in Detroit at the Detroit Medical Center, Children's Hospital of Michigan, where I did my residency in pediatrics.
So what is DAC Medicine? What is it and what is your mission for this company?
Well, DAC Medicine, as I said, is a company that provides nurse practitioners and physicians as well to assist the elderly in receiving care in their homes. The mission really is to help them to get better after they have been admitted to a hospital and they're back at home, to make sure that their medical care is appropriate. In addition, we do assist in managing some chronic illnesses in the home as well, to make sure that they don't develop serious complications of their illnesses.
I'm just curious, as a pediatrician, why are you all of a sudden now focusing on the elderly?
You know, it might seem unusual, but in fact, pediatrics and geriatric medicine are actually very similar. Both populations are relatively vulnerable. Both need some other people, other caregivers to assist them. So it seems unusual, but I find that my pediatric background in being able to relate to children, pick up on nonverbal cues, in relating to other caregivers, is actually very helpful in training, teaching nurse practitioners and physicians in how to approach the elderly at home.
I think that's such an awesome comparative. I never thought about that. And this seems to be sometimes the population that's kind of least attended to as well.
Exactly.
So what propelled you to really get into this field, this company?
Over the course of the past 20-something years, not going to see exactly how long it's been.
Okay.
I've had the opportunity not only to practice as a pediatrician, but to also manage, teach, direct physicians of other specialties, internal medicine physicians, physicians and nurse practitioners in urgent care centers, gastroenterology physicians, surgical physicians. So over the years, I've had a lot of interaction with these physicians. I've had to maintain quality assurance programs with those physicians. I've reviewed their records to make sure that their care is appropriate. I've put in place tools, equipment, medical record documentation to assist them in providing care to their patients. So I've had a good amount of experience in managing, directing internal medicine care of patients. I've been a medical director at a number of healthcare institutions. I've been a medical director at a number of health insurance companies. And the main areas that we tend to focus on in insurance companies is really the care of the elderly, because they tend to have many illnesses. They tend to be on a lot of medications that can have side effects and interactions with each other. So I've focused a lot of my time on the management of the elderly. So I've become very familiar with what they need.
It sounds like you have a great compassion as well for the elderly, which I think is very important in this field. So what would be a typical home visit? What would be a typical visit, would be like? What would that be like?
Yes, I love children. They have a passion for learning. I love the elderly. They have a passion really to share their experiences.
That's so true.
So spending time with them can be just tremendously beneficial. So when a nurse practitioner goes into the home, the goal is to do a complete assessment of the patient. Because, as I said, there are a number of medical conditions, a number of medications. You really do have to make sure that there are no side effects and that you're addressing all of the issues. If you don't, you run into the possibility of not addressing things that can cause difficulties in the future. So the nurse practitioner will gather complete history, gather information about what's been going on in the past with the medical condition, will review all of the patient's complaints, body area by body area, finding out if there are any problems going on, will assess the social situation, who's around, family members, children, caregivers, will take a look at the home environment to make sure that there are no obstacles, no dangers in the home. Based on the patient's ambulation, based on how easily they get around, might need to make sure that there are no throw rugs in the area where someone who's not able to pick their feet up all that well might trip over and fall. And finally, there's also a complete physical examination to pick up on anything that might be abnormal. One of the more important aspects of that assessment is a gathering of information about all of the medications that the patient is taking. Very often, when patients are admitted to the hospital, some of the medications they use at home are supposed to be stopped. When they get discharged, they are on some new medications. If the instructions at the time of discharge aren't very clear, you have an opportunity where the patient is taking medicines that should have been stopped, that could interact with medicines that have been started. You have the possibility of patients taking 2 different name medicines that are actually exactly the same.
Right.
And then you have a likelihood of an overdose of medications. So doing a complete medication inventory and then letting the patient know, stop these, continue these, is an important part of that assessment.
It's extremely key. It's
Yes.
extremely key. I had a father who, had heart problems, and he had all these medication. And he had problems trying to figure out how to use and everything. So I think it's also very important that you involve the family also to educate them as well. And why do you use nurse practitioners? Why is it that you use nurse practitioners?
Well, as I said, we use nurse practitioners and physicians, but in reality, most of the care is rendered by nurse practitioners. Nurse practitioners have a tremendous background in compassionate care for patients. They're accustomed to taking the time to review with patients what's been going on. They tend to educate a lot more than physicians might do. With that nursing background, they I think, able to bond with patients very well, and they do a tremendous job of teaching about patients' medical conditions. In addition, patients are very, very accepting of nurse practitioners.
You're right. You're absolutely right.
Very accepting.
Wow. So the other thing is, are these services covered by health insurance as well?
You know, that's a very good question.
Because I'm sure that we want to know that information, right?
Yes. Many insurance companies now are beginning to realize, quite frankly, that having someone go out to the home to take care of someone who is somewhat homebound or has some difficulty getting into their doctors can be very, very beneficial. So most insurance companies do cover this kind of service.
How does primary care doctors interact with your company?
Primary care doctors, for patients who are at home, either because that's a chronic situation or because they were in the hospital, they became a bit debilitated, can't quite get into their offices, primary care providers would call our company and ask us to go assist in taking care of someone in the home until the person is back up on their feet and can get into the office to see the primary care doctor. When we go in, we do call the primary care doctor, discuss what we've found, discuss the medications that are being taken or that have been prescribed, get feedback from the primary care doctor regarding how medications might need to be changed, and make arrangements for the patients to get back to the primary care doctor when appropriate. That's an important loop. It's important to keep them in the loop.
Absolutely.
They've had long relationships with patients.
Right.
So having them continue to participate in the care is tremendously beneficial to the patient as well as to the nurse practitioners who are making decisions.
It's probably, because I know most elderly, they depend on their doctors, and their doctors are almost like a god to them.
Yes.
So I think, though, weaning them, or I don't want to say weaning them, having that extra care, I think will be very beneficial for them. And I think it will be something that they could probably adapt to eventually. But I know elderly sometimes they get stuck kind of in, they want that doctor only,
Yes, of course.
So you think that might be a challenge at all?
It can be sometimes. And there are times when we have to call the primary care doctor and say, Mrs. Jones needs to see someone, but she wants your permission before she lets someone come in to see her. And that's totally okay. That's something that I think is good and something that we encourage. Again, we're not taking the place of the primary care doctor. We're really being an extender of the primary care doctor's practice.
So what kind of health conditions would you deal with at home?
Yeah. As extenders of the primary care physician, everything that can be taken care of in the office, almost everything, can be taken care of in the home. A lot of things that are taken care of in urgent care centers can be taken care of in the home. So the things that physicians manage in the office, diabetes. Someone comes in, the diabetes might not be all that well controlled. Blood sugar is a little bit high. A medication needs to be increased, or a second medication needs to be added. A decision has to be made that instead of just oral medications for treatment of diabetes, maybe insulin can be started. That can be done at home. There are patients who might have emphysema, bronchitis, chronic bronchitis, and they have an upper respiratory infection. They've gotten a cold, so they've started coughing, maybe wheezing a bit. The nurse practitioner can go into the home, do an assessment, examine the patient, give some nebulizer treatment, some medications through a nebulizer to get rid of the wheezing. The nurse practitioner can prescribe some antibiotics if that is appropriate, and other medications as necessary for the chronic bronchitis. The same thing for congestive heart failure. If it's not too bad, the nurse practitioner can give some medications, either by mouth or injected medications, to help to get rid of some fluid to treat the congestive heart failure. And of course, there are the usual infections that can be managed at home if someone is not able to get into the office. Upper respiratory infections, urinary tract